はい、次はチーアン先生でいらっしゃいます。チーアン先生はインターナショナルメンタルヘルスデベロップということでご講演をいただきます。先生のご経歴をご紹介いたしますと、現在メルボルン大学セント・ヴィンセント・メンタルヘルスサービス精神医学部国際精神医学科課長准教授をお務めになられておられます。で、他にもアジア・オーストラリアメンタルヘルスディレクターといった重要なお仕事や WHO のコラボレーションセンターのサイトディレクターという重要な役割を務めておられます。で、2005年以来ですね、19カ国が関わる精神保健開発プロジェクト、アジア太平洋地域のものですが、これをリードしていらっしゃいまして、精神保健分野におけるベストプラクティスを普及される活動をされているということでございます。で、さらに個別の国の精神保健プロジェクト、例えば中国、インド、東南アジア等ですね、さまざまなプロジェクトに関わっておられるということでございます。それでは先生、プレゼンテーションお願いいたします。
Thank you, Dr. Noda, for your kind introduction. I would like to present to you on the issue of international mental health development, some of which has already been touched upon by the previous speaker, Dr. Jisumi, but to elaborate more specifically on mental health globally. Just to also point out to you is that Asia-Australia Mental Health is a consortium of three partners: the Department of Psychiatry, University of Melbourne, Asia Link at the University of Melbourne, which some of the researchers have already visited, as well as St. Vincent's Hospital. So firstly, to highlight that the burden of mental ill health or mental illness is growing. Mental health issues now account for 13% of the global burden of disease. What that means is that more than 450 million people worldwide suffer from mental disorders, and many more suffer from mental health problems. It has already been mentioned about the growing suicide rate. The current rate is sitting around 16 per 100,000, or one death every 40 seconds. More importantly is this fact here, that 3/4 in low and middle income countries and up to half in high income countries, people with mental health problems do not receive adequate care, despite these statistics. In addition, there are many common challenges of mental illness in the Asia Pacific. These include, apart from the growing high burden of mental health problems, is the inadequate human resources, not only in terms of the quantity of mental health professionals, but also the level of skills and the quality of their training. There's generally poor access to appropriate care throughout the region. Where care is available, there is not sufficient community-based care. So most of the resources are still tied up with institutional care, and with the ongoing burden of mental health, the treatment gap of mental disorder and mental health problems is growing. And as already been described, stigma and discrimination continues to be a major challenge for the progress of mental health in the region. So how did we come to this state of affairs? The impact on mental health has many determinants. Many of these are psychosocial determinants. One is obviously the high population growth. We have just crossed the 7 billion population globally. But in addition, there is very rapid changing dynamics of population. The rapid urbanization and the migration of people from rural to urban areas is something that is unprecedented. the growing economic crisis that's affecting Europe and also different parts of the world, and previously in Asia, has a very significant impact on mental health of the population. In some countries, population are getting younger, particularly in the growing economic countries, and in other countries, population profile is getting older, such as in Japan. Despite the growing affluence of the population, the poverty gap is actually widening. And this has major implications, which I will come to later. Then this is the impact of climate change and disaster, which both Japan and Australia are familiar with. There's also changes in family structure. The traditional support system for individuals and families is also changing. And the different forms of social exclusion now, the changing community and the growing of social media is something that would have impact on mental health. So there is the association between social inequalities and mental ill health. We know that factors such as poverty, social inclusion, that leads to unemployment, low education, homelessness, these inequalities will have a direct impact on mental health. It can lead not only to stress, but also traumatic experiences. Then it could provide higher risk factors for development of mental ill health and ultimately development of mental disorder. And these can lead to psychosocial disability. And those people who are affected by mental ill health will, over time, be disadvantaged or be excluded from social participation, and they would end up with poverty. So it is a vicious cycle. So what have been the progress so far globally? We know that effective treatment is available, and the effective outcome is associated with different factors, such as a reduced reliance on large mental institutions, and to increase community treatment. And this applies to a comprehensive range of treatment, from ranging to treating the acute phase to the medium as well as the long-term rehabilitation phase. But it also requires support and partnerships in the community. It has been widely advocated that mental health services should be integrated with primary mental health care. And this has associated with increased access to basic mental health treatment. So these factors will lead to better clinical and functional outcomes. But often, these ideals are not achieved in many countries. Mental health is often given a very low priority or very low funding, and certainly many countries struggle to implement effective mental health plans. On the front of mental health promotion and tackling the issue of stigma, there have been many efforts. To tackle the issue of ignorance, this is an issue concerning the problem of misunderstanding, problem of knowledge. Efforts have been delivered, such as to provide fact sheets and information for particular target groups to increase the awareness among the population. To tackle the issue of prejudice, and this is to do with the problem of changing attitudes. It's important that we work with the community as well as the media to use appropriate language to describe mental illness and also to describe people suffering from mental illness. And the problem of behavior. As a result of ignorance and prejudice, people with mental health problems are often discriminated against. And we hope that the implementation of human rights law and their enforcement will help address this issue. In the Asia-Pacific region, there has been a widely acceptable principle that the need to care for people with mental illness in their own communities will bring better benefit. Many countries are establishing mental health policies and guidelines that reflect this change, including the recent mental health law that is happening in Japan. Since 2005, the Asia-Pacific Community Mental Health Development Project was started. And it began on the premise that Despite these challenges and the deficit, best practices exist in all countries. And it is only through collaboration and the sharing of these successes or best practice models that we can help promote the optimal outcomes through creating solutions and local adaptations of these models and forming effective partnership. The project really mirrors the evolution of mental health care. We started off with a focus on what are the best practices to link mental health care in medical facilities with the community. Then in stage 2, we look at how we best provide mental health care with community partners. And these are partners ranging from NGOs to schools to religious organizations to police, security, etc. And the third stage, we are hoping to look at ways, the best practice in ways of integrating mental health care into society. And obviously, this requires significant efforts in mental health promotion. As a result of this project, 2 publications have been produced to document these successful and effective models. And these reports were prepared by key representatives of ministries of health and peak bodies in the respective 17 countries in the Asia Pacific. And these are just the cover of those 2 publications. But more importantly, the project has led to various initiations and projects in promoting community mental health. For example, in China, we've been involved in a national community mental health project known as the 686 project that covers 30 provinces. We've also been involved in India in developing 4 model sites in community mental health reform. In Japan, as a result of the collaboration, this mental health collaboration is one of the outcomes. And there's also another collaboration looking at art and mental health. In the Sub-Mekong, we are looking at collaboration with the United States on developing a mental health research training institute. As well, there are efforts in Indonesia and in Pacific to support their local mental health reform. Now, globally, there is cause to be optimistic because mental health now is begun to be included in global initiatives. As Dr. Susumi has mentioned, the MDGs were first announced in the year 2000. We are coming towards the end of the MDGs in 2015. So many countries are looking at what should we do for the post-MDGs. In 2008 and 2012, non-communicable disease was on the agenda on the summit for the MDGs development. In 2012, the WHO Ministerial Conference included mental health within the NCD. The most significant development has been this year. Last month at the Commonwealth Ministers meeting, they endorsed the theme of mental health towards economic and social inclusion. And this was followed the week after by the World Health Assembly, where the WHO Global Mental Health Action Plan from 2013 to 2020 was launched and endorsed. I was invited to present a report for the mental health status for the Commonwealth countries. And this is not the Commonwealth of Australia, it's the Commonwealth of nations, of 54 countries. And the health ministers meeting, they have endorsed that there is a need to allocate appropriate resources to move from mental health treatment from the institution or hospital to community care. There's also the need to integrate mental health issues into national policies, plans, budget, resource development, as well as disaster response, and to protect the human rights of people with mental health problems through legislation and policies. It is also acknowledged there's a need to develop multi-sectoral partnerships across governments and NGOs and community agencies and families. There's also the need to integrate mental health services into primary health care. And importantly, to adapt community mental health models to local cultural context, because every culture and every setting have different needs. And it's important to develop appropriate partnerships with informal carers. In terms of what the WHO Global Comprehensive Mental Health Action Plan is, The core principle is underpinned by this slogan, that there is no health without mental health. There are also other principles. The need to provide universal access and coverage, the need to protect the human rights of people with mental health problems, the need to practice based on evidence and the current knowledge, the need to take a lifespan approach so that we look not only in terms of the acute problems, but across the course of life. And there's the importance of using a multi-sectoral approach. This is something that is very important. That is the empowerment of persons with mental disorder and psychosocial disability. So this has been endorsed now by all the countries of WHO, and certainly countries need to pay attention to how we can include people with mental disorders or psychosocial disability in the decision making about developing policies, laws, as well as services. These are some of the 4 key domains of the Mental Health Action Plan. Firstly, to strengthen effective leadership and governance for mental health. Second, to provide comprehensive integrated mental health and social care services in the community. Third, to implement the strategy for promotion and prevention. And fourth, to strengthen the information system, evidence and research for mental health. And the reason why we are here today, I think, is particularly to focus on how we can build research efforts to improve knowledge that would make a difference for people suffering from mental illness. By 2020, these are the targets that WHO hoped to achieve. That 80% of the countries would have developed or updated their mental health policies or plan. Half of the countries would develop or update their laws for mental health. And that the treatment gap from mental disorder will be reduced by 20%. And 80% of the countries will have at least 2 promotion and prevention programs nationally. That the rate of suicide in countries will be reduced, and that 80% of the countries will routinely collect a set of mental health indicators. These are very high goals, and all countries need to be making efforts to achieve this, not only in Australia, but also in Japan. It is, I believe it's a very timely to consider this, particularly now that mental health is included in the top 5 priorities for the Ministry of Health and the recent change in the review of the mental health law in Japan. And globally, I think that the time for action is now, that given the optimism and the momentum of the mental health movement globally. Thank you very much for your attention.
ドクター・チェン先生、ありがとうございました。ただいまのプレゼンテーション、WHO においても非常に、NCD の中に、精神疾患が位置づけられるなど非常に重要な疾患として、取り扱われると、そういう中でさまざまな視点から、プログラム計画が作られているということをお示しいただきました。またそういう中で各国において有効な対策となるにはやはり地域に応じてですね、その先進的なモデルをいかに適切にその場に応じた形で展開していくかということも示唆されたと思います。また社会の貧困と精神保健というものが悪循環になっているという中で、どのようにこの問題を解決していくかという重要な視点も示されたと思います。それではフロアの方から何かご質問。先ほどの堤先生、それじゃあ竹島先生お願いします。
チー先生、どうもありがとうございました。一つだけ質問させていただきたいんですけど、今回メルボルン大学とそれから、Ncnp のシンポジウムでやっております。チー先生が各国を行かれていて、日本とそれからオーストラリアが連携するっていうことの持つ、意味ということについて、チン先生のお考えを聞かせてください。
Thank you for your question, Dr. Takashima. It's a very important question and may take a long time to answer. But just a summary, I believe that international collaboration is very important because no one countries have all the answers. Even countries like Australia, UK or United States, even well-resourced countries do not have all the answers. And the best way for us to learn is to learn from each other, because each of us have different strengths and different experience. The one good example is the issue of disaster mental health that's often been discussed. That through exchange of information and knowledge, we can build on what we know so that we don't have to keep repeating the same mistakes or keep doing the things that have not been effective. So really to learning through these best practices is the way that we can try and address these challenges.
伊藤純一郎と申します。マンパワーの問題について伺いたいんですけれども、コミュニティメンタルヘルスのシステムを作るときに、メンタルヘルスプロフェッショナルは非常に数が限られていて、インテグレーティドメンタルヘルスシステムを作るのがなかなか難しいんですけれども、やはり市民の方を巻き込んで、あるいは患者さんやご家族の方を巻き込んで、その方々をメンタルヘルスプロバイダーにしていくとか、そういうあり方については先生はどんなふうにお考えでしょうか。
Thank you, Dr. Ito. That's a very relevant question. Even countries such as Australia, we will never have enough sufficient mental health professionals to meet the mental health burden. If we look at the prevalence of mental disorder, up to 15 to 20% prevalence, lifetime prevalence rate, we will never have enough psychiatrists or psychiatric professionals to address it. So it is very important for us to involve partners, particularly community partners, the carers, community groups, the so-called informal care in the pyramid of the WHO pyramid model is an essential part of developing an adequate community mental health system. So how do we engage them? How do we support them and provide adequate communication with them, and also to provide even training to help some of the NGOs and the community members to provide good care that would help in delivering this care is very important. So we must not just look at within the mental health sector, we got to look outside the mental health sectors, in the health sectors as well as the non-health sector.
どうもありがとうございました。